everyone. I'm just going to thank you for the introduction. I'm just going to briefly talk about how we came about this research. So thank you for inviting us here today. I actually see a lot of familiar names online, and that's really wonderful. And thanks for joining us before the long weekend. I'm sure we're all looking forward to a nice break right now, but hopefully this will be enjoyable for you as well. So I'm just going to provide a brief introduction on how this research came about. We know that swimming at public beaches is a popular recreational activity here in Canada, and even more so as we try to get outside during the pandemic and expecting, more beach activity this coming summer. And not only just swimming, but other popular recreational water activities like kayaking and paddleboarding. And poor recreational quality represents a risk of acute gastrointestinal illness for those that are enjoying those recreational water activities. But, mostly here in Canada, it's highly undetected and also underreported. And all bathers are at risk of acute gastrointestinal illness, but we know that the risk is higher in certain vulnerable populations, for example, in children, from infants to 10 years of age, and other vulnerable populations such as the elderly and immunocompromised. We know of particular waterborne pathogens, whether bacterial or protozoal or viral, which are the primary etiologic agents of contamination of our beaches. For example, E. coli and Enterococcus, Salmonella, Campylobacter, Giardia, Cryptosporidium. And within all jurisdictions are managed differently, but we have our mostly the public health units that are monitoring the presence of E. coli, which is a fecal indicator bacteria to indicate the presence of water pathogens. And epidemiological evidence shows that an increase in E. coli concentrations in freshwater recreational waters are associated with an increase in GI illness among bathers. We also know that environmental factors are involved with affecting water quality levels. And we've seen a noted increase in extreme weather-related events, which can have the potential for increased risk of waterborne infectious disease via contaminated recreational waters. So Dr. Ian Young and I, who unfortunately couldn't be here today, but also a professor at Ryerson University, decided to undertake this research to address the important gaps in understanding environmental factors associated with E. coli concentrations in freshwater beaches, and in the goal in developing tools to better predict their impact. And the aim for the results to support this climate change adaptation and response among local public health authorities, the ultimate goal of decreasing the burden of waterborne disease. And we were very lucky, we are very lucky to have an amazing collaboration with Niagara Public Health and Toronto Public Health here in Ontario with this research. And support from the Public Health Agency of Canada. And of course, the wonderful Joanna, who joined our team, which we are so happy about. She's just amazing. And so with that, I'm going to pass it over to the amazing Dr. Joanna Sanchez. Thank you. Oh, you're on mute, Joanna.
Sorry about that. Thank you. Well, thanks so much, Jordan, for that great introduction and for the unnecessary praise. So if anyone's wondering, yes, I am sitting on a Toronto beach. As you can see, anybody who's been to a Toronto beach will know that that's exactly where I am. But so let's get started here. So I'm going to provide just a brief outline of the presentation. I'm going to just quickly go through background, our research objectives, present our study setting, our data, and the methods that we're using to analyze these data, and go over just an overview of some of our results that hopefully you'll find interesting. And then we'll have a discussion, a presentation of our conclusions, and then we'll have some time to go over some questions at the end. So Canada is home to thousands of beaches across the country. Swim, Drink, Fish reports over 2,000 beaches. And of course, that's not the entire list, as there's several beaches that they haven't accounted for in their inventory, but just on their platform alone, we can see that beaches are widespread across Canada, increasingly popular, especially in the recent year during the pandemic, where people have to find local ways to entertain themselves outdoors. And so water quality becomes increasingly important. At the same time, there is quite limited data in the Canadian context. So there is research in, for example, Lake Michigan, in California, in Ohio, and some limited research also here in Ontario and across the country. But the majority is focused, North American research is focused in the United States. So we hope that with our research, we can add a bit more to that literature from the Canadian context. And while we focus on Toronto, our goal is that our results can be translatable and generalizable across the country to other freshwater beaches inland. So that's the goal here today. And we're so happy that we have representation from across the country. So that's quite exciting. So talking a little bit more about fecal indicator bacteria. So the presence of this bacteria is an indication of fecal material in the water. So E. coli concentration is the suggested bacteria to be used in freshwater beaches, Enterococcus in marine waters. But as our research focuses on freshwater beaches, I'll be talking about E. coli for the rest of the presentation. Now, the guidelines for Canadian recreational water quality were published in 2012. And threshold levels have been developed to suggest an acceptable and low risk of gastrointestinal illness. And this is based on research, literature across the world. And so in fresh waters, guidelines recommend that E. coli mean concentration remain at less than or equal to 200 CFUs per 100 milliliters, or a single sample concentration of less than or equal to 400. So single sample greater than 400 is justification for posting the beach as unsafe for swimming. And the geometric mean is calculated from a minimum of 5 samples. So recreational water quality monitoring falls under provincial and territorial jurisdiction. In Ontario specifically, beaches are regularly monitored by public health authorities through sampling during the summer season, which extends from early May until after the Labor Day weekend, or just the Labor Day weekend. And communication of water quality risks to the public is determined by each jurisdiction. And that may include a sign or flag posted directly on the beach, or directing the public to visit the local public health authority website. So water sampling specifically. So here's one of the Niagara students actually collecting water last summer. So the 2018 Ontario operational approaches for recreational water guidelines recommends that water be collected where depth is 1 to 1.5 meters deep. And samples are obtained 15 to 30 centimeters below the water surface. Samples collected are using sterile bottles provided by a Public Health Ontario laboratory. And for consistency, water samples are collected at the same location at 5 sites across the beach, so the same general location. Now, what are the limitations to this method? Now, as many of us here know, and I know there's a lot of, we have a lot of viewers from public health units, is that culture-based methods can take 18 to 24 hours to process. And so decisions about beach posting status are based on previous day concentration. And these delays can result in a risk to swimmers, as changes in environmental conditions can affect water quality in just a mere hours. And so understanding the environmental factors associated with water quality can inform beach monitoring programs. So here's where we get into our environmental factors. Here's some of the few that we focus here on this research. First, we have rainfall, air temperature, water temperature, stream discharge, wave height, wind speed, ultraviolet radiation, and turbidity. Now, just looking at rainfall in the past few years, well, not past few, actually a very long time. So here in Toronto, here's a weather station going back to 1840. And we can see that rainfall actually looks like it's on a bit of a decline there. But in the Niagara region, between 1910 and 2019, we actually see it on a slight increase there. But look what happens when we look at air temperature. We see a clear increasing trend in both regions. And this is a general trend that's being reported across the world. And so with climate change, environmental factors become increasingly important in understanding and the role that they play in beach water quality. Also at the same time as with longer summer season, longer swimming season, we're seeing more people enjoying the outdoors, more people enjoying swimming and bathing in the water. So this all becomes increasingly important. And so this takes us to our research objectives. The first was to determine which climate and weather-related factors were associated with higher levels of E. coli in public bathing beaches over time. And that's what we'll be discussing today. Our second objective, which is to come in the next year, is to develop user-friendly predictive models using a novel Bayesian network approach for selected beaches to assist public health authorities in their risk management decisions. So today I'll focus on the first objective, which is where we really explore the environmental factors associated with E. coli. So I'm excited to share some of the results to date. So let's start with our study setting. We have two very interesting regions. We have Toronto, the largest city in Canada with over 5 million inhabitants just in the urban population, with 11 beaches. So essentially all the beaches in Toronto. And the beaches are urban beaches located, right in the densely populated area. Then we have the Niagara region, which is a large region consisting of several municipalities. And of course, we know that Niagara is home to the world famous Niagara Falls and also the most popular wine country in Ontario. And so that region sees 14 million tourists annually. And with many popular and beautiful beaches there, it also gets lots of high traffic, not just from Canadians, but also from Americans just right across the border right there. So we included 8 beaches in our study from the Niagara regions. And these are among the essentially the most popular beaches. So we included over 5,000 E. coli observations from the Niagara region collected between 2011 and 2019, and over 14,000 E. coli observations from Toronto collected between 2007 and 2019. These data were then linked to environment data collected from Environment Canada's historical repository and also from a few different conservation authorities. So this data was collected through weather station data, for example, for rainfall. We also have buoy data for the two lakes that record things like water temperature, height. And we also have river sensor data for sensors located in the various rivers that we linked to the respective data for the two regions. So looking at Toronto here, we have 11 beaches, as I mentioned, just scattered along the coast there. A lot of them centered close to the downtown of Toronto, actually. But we also linked the data to 3 rivers. And these rivers were important because there are beaches located close to the mouth of the river. And then we also linked the data to a few UV stations to get some UV index data, as well as to buoy data. Niagara region is very interesting in that there are 2 Great Lakes that we're able to explore in one shot right there. So we have 2 beaches located on Lake Ontario, and we had 6 beaches located on Lake Erie. At the same time, Niagara has the Niagara River, which is extremely, has the extremely powerful Niagara Falls, as I mentioned, but it means that this river has a very high discharge all year long, high stream flow. And then the other major stream, we can't even call it a stream because it's also a big water source, is the Welland Canal, which is essentially the main point of connection between Lake Ontario and Lake Erie for transport ships. So we've got a lot of interesting things happening here in the Niagara region. We link the data to 2 different buoys, obviously, according to geographic location based on which lake the beaches were located on. And then we have the Buffalo Airport data for UV indexes. That was the closest station collecting UV information. And then each beach is linked to the weather station located closest to them. So we use 3 different weather stations in the Niagara region and then based it on geographic proximity. So let's look at the beaches in Toronto. So 2 takeaways here. The first is the variability between the beaches, as you can see. Some beaches kind of moving along steadily throughout time. We have a beach here called Gibraltar Point, not much fluctuation across time. But then we look at a beach in green, like Marie Curtis, where we see it spiking up quite a bit in 2008, 2010, and then it starts to drop off. But what I'm pointing out here is the difference that we really see between the beaches, and it really gets us thinking about, well, perhaps we really need to look at this from a beach specific level. The other point I want you to take away here is that we're actually seeing a decrease. And while I do not include a regression line here, the trend that we are definitely seeing is improvement in water quality in Toronto. So that's fantastic. Similarly in Niagara, we also saw higher values earlier on, especially from a beach like Queens Royal Beach, an improvement there. But again, differences across the beaches and worth exploring at a beach specific level. In terms of beaches being posted as unsafe for swimming, and this is again based on high E. coli levels, we're also seeing a general downward trend in the two regions. Niagara also reported on other reasons for closure, and I will point out that in 2019, water levels were very high in Lake Erie, which also impacted Lake Ontario, and there were a lot of closures that year. So that's what we're explaining there. But essentially, we are seeing a downward trend in closures for beaches posted as unsafe for swimming. So let's talk about our analysis methods. So the two main methods that we are exploring for our objective is a path analysis, which I'll get into a little bit more. I'm not going to go into too much specifics, but we conducted this in the Niagara region, and this allowed us to examine the relationship between variables. And then we also applied multi-level modeling approach to both regions, which allows us to examine beach-specific and geographic-specific effects. So let's start with the Niagara region path analysis. So the Niagara Public Health Authorities collect several parameters locally. These include turbidity, outfall, and shore wave height. Turbidity was collected from the third water sampling location and tested on site. And so the availability of this data allowed us to examine the relationships between variables. And outfall E. coli was sampled on a weekly basis at several beaches, and essentially was collected from the water runoff outflow source on the beach at a subset of beaches, as I mentioned. And then the other point was wave height. So we collected wave height from the buoy data, but at the same time, Niagara was also collecting it right at the shoreline. So we can see actually one of the students here last summer collecting it. And this also allows us to have another variable that we can examine, movement directly at the shore. So I've highlighted the three variables in the Niagara region that actually allowed us to examine these intervariable relationships a little bit more, which is quite interesting and exciting, and very seldomly, if not ever really done in this area of research. So here's how we explored specific environmental variables. Precipitation, we hypothesized that, and based on the literature, that precipitation would have, we would look at precipitation in the preceding days. Whether it's raining on that day will not have much of an effect on E. coli at the moment of collection, because the samples are collected early in the morning. And so we're really interested in what's happening before that resulted in the current conditions. So we looked at cumulative precipitation in the previous 48 hours. The other variables that we looked at from the preceding day were UV index, 24-hour air temperature, buoy wave height, and E. coli, so previous day E. coli. And this is an important point considering that this is the variable that's being used right now to determine current posting status of beaches. Same day variables included stream discharge, turbidity. Turbidity is collected at the same time of water sampling. Outfall is also outfall E. coli levels, also collected at the same time as water sampling. And same as I mentioned before, the same day shore wave height. So that's also collected at the time of water sampling. So path analysis, without getting too much into the modeling, because that's not the point today, but it's a powerful statistical method for examining causal patterns among variables. And this is very useful in understanding the relationship between variables. What's exciting about this, applying it here, is that to our knowledge, this is the first application to examine predictors of fresh water quality. And so we're able to go beyond just saying, well, these variables associated with E. coli, and actually say, well, how are they related to each other? How are they? And then how does that impact E. coli? So the first thing you do is you created a conceptual diagram based on the literature, based on knowledge to date, and based on our own hypotheses. So we hypothesized that, for example, I'll use rainfall as an example here, that rainfall had a direct effect on log E. coli, so on E. coli concentration, but that it might also have an effect on turbidity. Perhaps a heavy rainfall can stir up the water and increase the murkiness of the water. And so it could have an indirect effect on E. coli concentration that way. We also hypothesized that rainfall in 48 hours might also increase stream flow, which then has its own effect on E. coli concentration. And so that's what we tried to examine here. You know, is it just rainfall directly affecting E. coli, or is that happening also via other variables? And here are some of our results. So overall, we found, and we'll go from left to right, 24-hour air temperature had a positive effect on E. coli concentration, but interestingly has a negative effect on stream discharge. But this negative effect is essentially undone by the fact that stream discharge itself has a positive effect on E. coli concentration, a positive effect on turbidity, which also has a positive effect on E. coli concentration. So this negative effect would have to be quite strong in order to overcome these positive effects. But overall, the effect of air temperature was positive on E. coli concentration. So that's just to show you some of the relationships we can explore using this method, which is quite interesting, at least to me, but I'm nerdy like that. So in terms of previous day E. coli, similarly, we found it going through turbidity and also having a direct effect. Rainfall, interestingly, even though we hypothesized that it might have an effect on stream discharge and turbidity, it was direct effect on E. coli, not having an indirect effect via any other variable, which we thought was quite interesting. UV index had a negative effect on turbidity, and that ultimately negative on E. coli concentration through that strong negative effect. And here where it gets a little interesting with wave height. So we have two wave height variables. And for those statistically savvy people, they might ask themselves if there was collinearity by including two wave height variables. The answer is no, because the variables are actually quite different. So buoy data is collected quite offshore, sometimes a few kilometers away from the beach, and is essentially measuring wave height, quite in the water. And then same day shore wave height, as you saw from where the student was collecting, is right on the shore. So what we're seeing with shore wave height is movement that's actually happening right where the bathers are, essentially. And so the offshore wave height was actually having a negative effect on E. coli concentration. And as you'll see later, that was across all beaches. But we thought this was paradoxical at first. And then upon examining this further and looking into hydrodynamics, one of the suggested reasons for this might be that this is creating strong offshore currents, movement in the water, and might actually be having a flushing effect on the beach water. So actually clearing it out a bit and pulling out that E. coli. So creating movement in the water versus stagnant waters where we often see this E. coli concentration being problematic as well. Whereas onshore wave height had a positive effect. So that could also be because it's stirring up the sediment, the bottom sediment, and then suspended particles are linked with E. coli, and so increasing the concentration. So any E. coli sitting on the bed, on the floor, would then be stirred up. And so we're seeing these two interesting relationships, but both of them had a positive effect on turbidity. So they created that movement in the water that stirs up turbidity. But I will tell you that even though that's had a positive effect on turbidity, the overall effect of wave height was negative because that negative effect was so strong. Now, the next few slides I present the beach-specific models. I'm not going to get into the details, but what I'm really trying to show here is that we're seeing differences. There are clear trends across the beaches, but the most important takeaway is that there are some differences between the few that are not negligible and it should be considered as we go into the next phase of developing our predictive models. So here's, we have Bay Beach, where if I go to the previous and then to the next, you see that some variables have actually disappeared. Still going strong is rainfall, the wave height, E. coli, air temperature, and our turbidity, which continues to be a mediator for so many variables. And by mediator, I mean that other variables are having an indirect effect on E. coli concentration via turbidity. When we add outfall to the mix, outfall has a positive effect on E. coli concentration, and the positive effect on turbidity. So therefore, it's by two different pathways has a very positive effect on E. coli concentration. So increased E. coli outfall levels have resulted in increased E. coli concentration, not surprisingly. Lakeside, we see UV index make an appearance again, being important in having that negative relationship. At Long Beach, similar relationships happening there. We have a bit more mediation happening through turbidity, so a lot of them are interacting with turbidity. When we add outfall is also having that positive effect, consistent with what we saw previously at Bay Beach. Nickel Beach, we've lost UV index, and their stream discharge also continues to not be important at this beach. But then we get to Sherkston and Elko, something interesting happened. Rainfall was suddenly not an important, statistically significant variable in predicting E. coli concentration. And however, stream discharge was back in there. And its sister beach, Sherkston Witherwood, which is right beside it, we found a similar model without rainfall having an important relationship with E. coli concentration or being an important variable on this path. Finally, the last beach in Niagara, rainfall was back in there, but again, same sort of trends happening here. The direction of all the relationships are the same, with that wave height offshore having that negative effect and all the other variables having that positive effect. So what are the big findings here? Well, turbidity was found to be, turbidity was found to be an important mediator for the indirect effect of indirect and direct effect for environmental predictors overall and in all beach specific models. So turbidity was there in all models and interacted with other environmental predictors across the board. So that was consistent. Rainfall was an important direct predictor for E. coli in most models, except for the two Sherkston beaches, which was interesting. Previous day air temperature and E. coli had direct and indirect effects on E. coli concentrations. And wave height, as I described before, shore wave height had a positive effect on E. coli, while offshore wave height had a negative effect on E. coli. So some interesting findings there. Now I'm going to jump to Toronto. So the next modeling that we did was a linear mixed effects modeling or multi-level modeling. How does this go further than multiple regression models? So one of the common used modeling methods in water quality prediction models is multiple regression models. Well, here what we do, we take it a step further and actually try to look at whether the variables cluster at a beach specific level and geographic level. So we're actually trying to understand if there were also beach specific effects. And so that's why we call it multi-level modeling. Now, we did this for both regions. The Niagara region models supported the path analysis model, so which is why at this point I'm going to discuss, just for this presentation, the preliminary Toronto models. Now, we identified several environmental factors that were positively associated with E. coli. I've put them here as air temperature, E. coli, wave height, and I will point out that Toronto wave height was only that was collected offshore. They did not do onshore shore wave height collection. And then we have rainfall, had a positive effect, and then UV index, negative effect. And while I didn't describe it before, this is widely described in the literature. What we're seeing with ultraviolet radiation is that it deactivates the DNA of the pathogen. So we're actually seeing it killing off essentially the bacteria. So increased UV index was actually associated with decreased E. coli concentration. In terms of beach-specific effects, we found that air temperature, wave height, UV index, and stream flow had significant beach-specific effects. So this suggests that unique contamination sources and factors that affect E. coli levels. Now, Toronto also had some interesting data collection points that we're exploring further. They have what I'm calling the lifeguard variables. So lifeguards collected several additional observation variables. For example, for water quality, they collected whether the water was observed to be clear, mixed, or murky. So increasing turbidity. So we can use this as a proxy for turbidity. And then waterfowl. So whether there were seagulls, ducks in the water, and an estimated count of these water birds. We included these variables in the models as well, to the previous models that I just presented, and both were statistically significantly and positively associated with increased E. coli concentration. So more birds on the beach at the time of collection was associated with increased E. coli levels, as was whether the water was reported to, if the water was reported to be murky, it was also associated with higher E. coli concentration. So that's quite an interesting point there as well, and perhaps to be explored further. Now, the last piece I wanted to add in here was a telehealth analysis. Now, this is sort of an add-on piece as we're really trying to explore acute gastrointestinal illness. So to associate the association between preceding rainfall, beach and beach water E. coli levels in our 2 study regions and how that affects the rate of acute gastrointestinal illness, we linked the data that we have, so the beach data, with historical Telehealth Ontario data. So what's Telehealth Ontario? It's a 24-hour phone line for Ontario residents to speak with a registered nurse about possible illness. And it's as a first point of contact in the healthcare system, especially important now as we're trying to prevent people from going into emergency rooms and hospitals and such. So it represents an early warning syndromic surveillance system for acute gastrointestinal illness. And this is very important, as essentially the reason we're doing all of this water monitoring and really trying to control water quality is because we're trying to prevent acute gastrointestinal illness. So we did this by using a methodology called distributed lag nonlinear models. And we were able to evaluate associations between average beach E. coli levels, preceding extreme rainfall, and AGI. Telehealth reported this as diarrhea and or vomiting. And we looked at the rates of that in the 2 regions during the summer months. E. coli data were lagged 10 days prior to illness, and rainfall was like 12 days to account for the influence on beach water quality. So that's consistent with what we did before with the 48-hour cumulative rainfall. That 12 days gives that extra 2 days to try to see if there was an association between rainfall and also water E. coli levels. We also controlled for other environmental variables, as you know, our team is very much interested in the environmental variables. And so we looked at air temperature, stream discharge, and mean UV index. And these were all lagged 11 days to account for influence on beach water quality. So again, to account for the 24-hour influence that we also did for our other models. So trying to be consistent across the board in the way we approach these variables. So here's some of our preliminary results. In Toronto, increased previous day cumulative rainfall and extreme rainfall, that's higher than 99th percentile, in the preceding 12 days was associated with increased rates of AGI calls among adults. In children, beach E. coli levels and heavy rainfall higher than 95th percentile were associated with higher AGI rates. So I should point out that telehealth was actually able to divide the calls into adults and children for us. So we're able to actually look at adult calls versus children as well. In Niagara, rainfall levels were higher overall, and preceding heavy rainfall and higher than 95th percentile was associated with increased rates of AGI calls in both adults and children. Beach E. coli levels, specifically 6 to 7 days prior, were also associated with HGI in adults and children, so both. So our preliminary results suggest a relationship between preceding rainfall, beach water quality, and AGR in our study regions, and it's something we definitely want to explore further. So using several advanced statistical methods, we aim to further understand the relationship between environmental and climatic factors and E. coli concentration at freshwater beaches and 2 of the Great Lakes, specifically in the Canadian context. And we identify the key variables associated with water quality and gain a better understanding of the intervariable relationships using this very powerful statistical method that I previously described. We aim for the results of our study to be used to inform beach programs and to reduce the burden of waterborne diseases. We identified the relationship between variables and the various indirect effects of E. coli. So a big finding was turbidity data was regularly collected in the Niagara region, was found to be quite important for in predicting E. coli concentration. not only because of its own relationship with E. coli, but because it was an important mediator for indirect effects of other environmental predictors. And this is quite important because in our a quick scan and also reviewing the literature, we see that it is not necessarily a data that is turbidity data is not regularly collected across all public health units, necessarily across North America. So it really allowed us to examine that and perhaps really evaluate the importance of understanding turbidity, maybe even collecting it as part of beach monitoring. Cumulative rainfall in the previous 48 hours was positively associated with increased E. coli concentration in both Toronto and Niagara in different models. So this is consistent with what is reported in the literature across recent studies across the world in temperate climates. So another point for that. Previous day mean temperature, geometric mean, wave height, UV index, and same day stream flow were associated with E. coli concentration in various models as well. And what we found in all our models is that beach specific effects were important and were identified. Heavy rainfall, as I mentioned, our last analysis was associated with increased rates of acute gastrointestinal illness, telehealth calls in both adults and children in both regions. So where do we go from here? Well, our first goal is to finalize and publish the results of our various analyses. And then we go into objective 2, which is to develop the predictive models using this novel approach and everything that we've learned from objective 1. The next step is to run a prospective cohort study to determine the incidence of burden of recreational water illness in these 2 regions. And we've actually submitted CRHR application for funding. So we're hoping to be able to conduct this in the future and actually get more information on this. I, of course, would like to acknowledge my co-authors, Dr. Jordan Tustin, Dr. Ian Young, and Cole Heasley, our research assistant, who have been fantastic, and we've been working hard at trying to get these results in. I want to give a very special thank you for the 2 public health units for being so collaborative and providing access to the data. We thank everyone that was involved in the data collection and management in the 2 units. Specifically, I'd like to acknowledge Jeremy Kelly, Anthony Habian, Ryan Waterhouse, and Mahesh Patella in the 2 units. We also acknowledge funding from the Public Health Agency of Canada. So thank you very much. So contrary to the beach that you see behind me here, which, you know, as I think you've all figured out, is not Toronto, this is actually a beach in Ontario. So we do have some blue waters here in Ontario. So we actually, before we get to the questions for me, we did have a few questions for our viewers. And I think Tina was going to try to see if we can set up a poll that everybody could vote in. So the first question.
Go ahead,
Sure.
sorry.
Sure. So the first question is, do you work in beach water quality? So as a beach manager, public health unit staff, data collection. I see everybody's answering. Okay. Okay, I think we got our answer. So almost 50-50, yes, no.
Shall we move on to the next set?
Yeah, let's go to the next question.
Okay.
Thank you for everyone that answered that. Number 2, do you think predictive modeling would be a useful tool for recreational water quality management? Yes, no, or don't know? Okay, overwhelming yes. Stay tuned for more from us on that then. I think we can go to number 3 now. We may have, Tina might be frozen. Oh, here we go. Sorry, I can't see it.
Yeah, just scroll down.
For those representing public health units, does your unit collect turbidity data? Multiple choice. Yes, no, don't know.
Okay, shall I end the poll and move on to questions now, Joanna?
Yeah, I think we can end the poll. I think maybe
Okay.
Joanna had a little issue there. I saw her freeze for a second.
Yeah, it looks like she's muted now. Her camera's off. Okay, I'm going to end the poll and maybe we'll move on to questions first. Thanks for everyone who joined, who entered the, answer the polls. All right, so first question from Dave, wondering if the outfalls were treated wastewater effluent or storm drainage, and if combined sewage overflows were considered. Joanna, I'm not sure if you're still there.
I am here. Sorry.
I'm not sure if Joanna is signed in.
It looks like she's muted. Just giving her a bit more time to join if she's lost connection. Joanna, are you still there? Looks like she's still sharing her screen, but
Yeah.
But not there. Perhaps, oh, I think she's gone now. Sorry about the technical difficulties, everyone.
Oh, she's in the waiting room. I'll
okay.
admit her.
Okay.
Oh, you're back, Joanna.
I am so sorry. I do not know. I think my internet connection failed me.
It happens. So we've started the questions, and Tina, if you want
see them
to
coming in, I just couldn't or hear you.
Oh,
yeah,
that's okay. It happens. So the first question from Dave is wondering if the outfalls were treated wastewater effluent or storm drainage, and if combined sewer outflows, or sorry, overflows were considered.
Sorry, one sec. Is this written out? I think I can't see it.
Yeah, just if you just click on the chat window.
Yep. Yeah, I'm sorry, I can't see them. So in terms of the combined sewer, that's a very important point because it is actually a major contributing factor in water quality. A lot of New Zealand models actually found that to be one of the most important variables in their models. And we expect that there's a combined sewer might have a contribution here in Toronto, but unfortunately we did not account for that specifically in our models, and perhaps something that we can examine further in the future. I hope that answers the question.
Okay, thank you. Next question from Janine. Is there screening of the telehealth callers to see if they had exposure to a recreational water?
No, unfortunately not. So there's a lot of research on, not a lot, but there's a few studies that look at emergency room admissions. And so we were following a lot of the methodology there, but unfortunately what we're doing here is it's a simple scan of incidence, of rates, and whether we see any increases. So in some of the emergency room data, they notice a bit of a, not necessarily a spike, but there was an association between heavy rainfall and emergency room visits associated with acute gastrointestinal illness. So that's what we try to mirror here using available telehealth data. And so there, we didn't specifically ask whether they had visited a beach, whether they'd been exposed to recreational water, but we're just essentially trying to examine if there's some potential link going on there that needs to be examined further. So at this point, this analysis is preliminary, but perhaps we need to look a little bit more. But I think at this point, all that we can report is there's an association, a statistical association at least. What that means is it remains to be examined a little bit further.
Okay, thank you. Next question from Martha. We only use predictive modeling at one of our 5 public beaches, not at all of them. Oh, sorry, that was not a question. Okay, great. Next question. Perhaps more of a comment from Ralph. Microbial source tracking would also be a useful tool to be used along with predictive modeling.
Absolutely. We definitely think this is very important because it can tell us exactly where it was, where the pathogen came from, and it's definitely something we want to incorporate more in our future research. And hopefully, if we are able to do our beach cohort study, we do plan to include that in there as well to have more understanding in both regions, in Toronto and Niagara. So hopefully more to come on that, but definitely a very important point. So thank you for bringing that up.
Next comment from Bernard. Predictive models are only useful for those beaches that have poor water 50% of the time. As water quality can change from the morning to afternoon for predictive models to be useful, they should be run twice a day or 7 days a week. Resources should be spent on sources of contamination.
Yeah, I think these are very important points. I think understanding what the sources of are definitely important. So if, when you have an urban setting, we expect that water runoff will obviously be an important factor. We hope to examine that a little bit more in Toronto. But in terms of like actual contamination, chemical and such, it's not really what we're trying to address specifically here. We can only focus on the environmental factors at this point and how weather pattern changes affect essentially water quality. But definitely an important point. And also in terms of running predictive models, something we'll definitely be thinking about in terms of how frequently they will need to be run in order to accurately predict water quality.
Thanks for that. Just waiting for more questions to come in. And we still have about 9 minutes left in the webinar.
I see a question from Martha asking about in telehealth where ear, eye, skin infections discussed.
Yes.
Yeah. So Martha, so telehealth essentially only captured whether it was diarrhea or vomiting. So unfortunately, we don't have those specifics in that category.
Okay, are there more questions from the audience? And yes, for those of you who asked about whether these recordings will be shared, yes, we will be sharing the recording next week and sending them to all registrants. A question from Lydia. With heavier precipitation expected with climate change in certain regions of Canada, would there need to be different adapted predictive models according to regions tied to climate data?
That's an important question and definitely something for us to consider. We were surprised to see, I mean, maybe not too surprised, but a difference between Toronto and Niagara, just 2 hours apart from each other. And we noticed heavier rainfall just upon examining the data between the two. And so, and we do notice a little bit of difference in terms of the variables involved in the beaches. So I think not only do we need to look at beach specific effects, but also regional. And that's what we're hoping to address a little bit here as well by looking at 2 regions. But I definitely think we are going to have to think about adaptive predictive models at the regional level, maybe even beach specific. That's an important point, absolutely.
Next question, was beach sand examined?
No, but definitely important. So because we were collecting data that was used by, collected by public health units as part of their beach monitoring program, they only do water sampling and of course some of the other variables that I presented there for the lifeguard data and for the Niagara PHU data. But for this study, we are looking at retrospective data and not actually collecting new data, but definitely that sand is an important factor to consider as well, and an important predictor of the water quality, as essentially we expect that E. coli pathogens present in the sand also make their way into bathing waters. So perhaps something for us to think about as we do a prospective study.
Next question, did you consider the lake turnover effect that occurs when a lake is 4 degrees Celsius? There could be possibly a link to turbidity.
No, and that's very interesting and something I'll look into further. Thank you for that, Jordan. Definitely not considered, but thanks. I will be reading a little bit more on that and making note of that.
Next question, was proximity of pet parks / beaches considered when looking at the data?
No, but I was thinking about that as well. So the first picture on my slide is actually a picture of Cherry Beach in Toronto, and 100 meters away from where I took that picture is the dog park. And you will see dogs running around in there, collecting their balls, just swimming. And I wonder about that. We talk about waterfowl, but we think about off leash as well, and perhaps other animal sources. So definitely we are thinking a lot about how to incorporate that in future research, really think about animals, not just birds. So thank you.
Just a comment from Lydia, perhaps a very useful, productive potential collaboration with Intact Center at the U of Waterloo.
Sure, happy to chat more about that.
And next question. Certainly site-specific beach water quality predictive models are worth considering, as each beach has various factors affecting water quality. That's more of a comment. I see
Bernard and both Rainian have made similar comments about each beach requiring its own model. I definitely agree, and that's what I've tried to show here as well by showing the different path models that we see trends across, and I think a few variables held throughout, but what we're really seeing is that they changed. No 2 models were identical, even what I would call sister beaches, the 2 Sherkston beaches, very similar models. They both didn't have rainfall associated, but slight differences in terms of those pathways. So absolutely, we need to think about it at the beach level. And definitely something we're learning it in the first objective as we go into our second objective. So thank you for reinforcing that.
Okay, so at this point, I just want to thank Joanna and Jordan for joining us today to talk about their project. And we do have a link to our evaluation survey for this webinar. I will put that into the chat box. Please help us fill it out. Oh, one more question that just came in. Will your work contribute to the new Recwater quality guideline?
I hope so. I think we'll have to see how to try to influence that. That's a good point.
Okay, fantastic. Okay, well, thank you everyone for joining us today. And as I mentioned, please fill out the survey so we know how what your feedback are for this webinar. And have a great weekend and see you next time.
Yeah, well, thank you very much, everyone, for joining and learning a little bit about this. We hope to share more results in the future. So stay tuned for our publications and hopefully future presentations. But something exciting to talk about as we enter beach season, something to look forward to, not only as public health units, but also as beach goers ourselves. So thank you very much. We hope you learned something. Thank you for your comments and contributions. Definitely, we'll be considering a lot of them. And have a great long weekend. Happy Easter to those celebrating, and happy spring.